What is neurogenic bladder, and how do nerves control it? Imagine your bladder as a well-coordinated team that relies on signals from your brain and spinal cord to work smoothly. When everything functions properly, your brain knows when your bladder is full and sends signals to relax or tighten muscles to store or releases urine. But if the nerves that send these messages are damaged or not working right, it can cause a condition called neurogenic bladder. This means your bladder doesn't get the right signals, leading to problems with holding or emptying urine. The control of your bladder depends on a complex system of nerves and muscles. Nerves from your brain and spinal cord communicate with the muscles in your bladder and the sphincters, which are rings of muscle that open and close to let urine out. When you are ready to urinate, your brain signals the bladder muscles to contract and the sphincters to relax, allowing urine to flow out. During storage, the muscles tighten to hold urine, and the sphincters stay closed. If these nerve signals are disrupted, the bladder may not contract properly or may contract involuntarily, causing symptoms like urgency, incontinence, or difficulty starting urination. Nerves involved in bladder control include both central nerves from your brain and spinal cord and peripheral nerves that connect to the bladder muscles. Damage to any part of this system can cause neurogenic bladder. Common causes include spinal cord injuries, multiple sclerosis, Parkinson's disease, strokes, diabetes-related nerve damage, or birth defects like spina bifida. Depending on the type of nerve damage, neurogenic bladder can present in different ways. There are mainly two types of neurogenic bladder. One is overactive or spastic bladder, where the bladder muscles contract involuntarily, leading to sudden urges and leakage. The other is underactive or flaccid bladder, where the muscles cannot contract properly, causing urine retention and overflow leakage. Both types can lead to complications such as urinary tract infections, kidney stones, or even kidney damage if urine backs up due to improper emptying. Diagnosing neurogenic bladder involves a detailed medical history, neurological exams, and specialized tests called urodynamic studies. These tests measure how well the bladder and sphincters are functioning and help determine the best treatment approach. Managing neurogenic bladder aims to control symptoms, prevent infections, and protect kidney health. Treatments may include medications to relax or tighten bladder muscles, catheterization to drain urine, bladder training exercises, or in some cases, surgery. From a bladder health perspective, keeping nerve function healthy is key to maintaining normal bladder control. While neurogenic bladder itself is not linked to bladder cancer, chronic urinary problems and infections associated with nerve damage can increase the risk of complications. It is important to work closely with healthcare professionals to monitor and treat this condition properly. Remember, each person's situation is unique, so personalized medical advice is essential. Understanding how nerves control the bladder helps us appreciate the importance of neurological health in bladder function and overall well-being.